Welcome to the deep dive. Have you ever wondered why some dogs seem fine with certain meds, but others, well, react really badly?
Yes, it's a common question.
Today we're getting into something specific. Ivermectin toxicosis in dogs. We've looked at some detailed vet resources.
Good stuff.
And our mission really is to help you understand the risks of ivermectin overuse, especially these breed sensitivities and, the biology behind it all.
Exactly.
So here's the main point up front. Ivermectin, usually safe, often essential, but high doses can be dangerous, particularly for certain dogs. There's a genetic reason.
Right. And most people know ivermectin maybe from heartworm pills, right? Monthly preventatives.
Sure, very common.
And at the right dose, for most dogs, it's totally fine, effective. But the sources we looked at really stress that when you get into these much higher kind of off-label doses, yeah, that's when the risk of serious problems really jumps up. It's crucial owners get why that happens.
Okay, let's get down to basics then. What is ivermectin exactly? How does it actually take out parasites?
Okay, so ivermectin is part of a drug family, the macrocyclic lactones. You might have heard of others like maybe milbemycin, moxidectin, selamectin. They're all in that group, used for different pests.
Right, I've seen those names.
So ivermectin's main job is to mess with the nerve and muscle cells of invertebrates, the parasites.
How does it do that?
It latches onto these specific channels, glutamate-gated chloride ion channels, and binding to those basically, it paralyzes the parasite, and they die off.
Okay.
Now, what's interesting is that it can interact with similar channels in mammals, too, including ones linked to GABA.
GABA, the neurotransmitter.
Yeah. But normally, at the correct doses, that interaction is really minimal, not usually a problem.
So it's like a targeted weapon, but if you use too much firepower, there's collateral damage potential.
That's a really good way to think about it, actually. The sources are clear. Toxicity in dogs, it almost always happens with these much larger doses.
How large are we talking?
Like 10 to 15 times the recommended amount, sometimes even more. That's when things can go wrong.
And this connects to the breeds, right? Because our reading mentions some breeds are way more sensitive to these higher doses. Why is that?
Yes, this is super important. Certain breeds, Collies, are the classic example, but there are others, they just have a much lower tolerance.
Okay.
And it boils down to their genes. There's an inherited defect, a mutation, in a gene called ABCB1.
ABCB1. Okay, what does that gene normally do?
So think of the ABCB1 gene as the blueprint for making a tiny pump. It's called P-glycoprotein.
P-glycoprotein.
A pump, yeah, a transmembrane protein pump. It sits in cell membranes in various parts of the body, but a really critical spot is the blood-brain barrier.
Ah, the brain security system.
Exactly. Controls what gets in and out. And P-glycoprotein's job there is to actively pump certain substances out of the brain tissue back into the blood.
Okay.
And one of the things it's believed to pump out is ivermectin. So it acts like a bouncer, keeping ivermectin levels in the brain low.
Right. So if that pump, that P-glycoprotein, isn't working properly because of the gene mutation.
You got it. If the dog has this ABCB1 gene deletion or mutation, the pump might be faulty, or maybe there just isn't enough of it.
And then
more ivermectin can slip past the blood-brain barrier, build up inside the brain. And that's what causes the neurological signs of toxicity.
Makes sense. And you said it's not just Collies, right? Which other breeds are known to have this?
Good point. Besides Collies, this ABCB1 mutation pops up in Shetland sheepdogs, Australian shepherds, Old English sheepdogs, German shepherds, English shepherds too.
Quite a list.
And long-haired whippets, silken windhounds.
Yeah.
And actually it's found in a lot of mixed breed dogs too, especially if they have some of those breeds in their background.
So if you have one of those breeds, or even a mix that looks like one.
Definitely something to be aware of, yeah. Talk to your vet about it.
Is it like black and white? You either have the mutation and react badly, or you don't.
Well, the sources say it's a bit more complex than that. Dogs that are homozygous for the deletion.
Meaning they got the bad gene from both parents.
Exactly. 2 copies, they're usually the most sensitive. They'll likely react more severely, maybe even to lower high doses.
Okay.
But dogs that are heterozygous, just 1 copy of the mutated gene, they might still react, but probably need an even higher dose to trigger it compared to the homozygous ones.
Interesting.
And the research suggests age or sex doesn't really factor into the sensitivity. It's all about the genes.
Okay, so we get the why now. What about the what? What are the actual warning signs, the red flags, if a dog has gotten too much ivermectin?
Right. The symptoms, they can vary, but some things often show up first. Mydriasis, that's just dilated pupils.
Big pupils.
Yeah. And just seeming really depressed, lethargic, Maybe excessive drooling, salivating, vomiting's common too.
Yeah?
And ataxia, that wobbly, uncoordinated walking.
Okay, those sound like definite signs something's wrong.
And it can progress. You might then see tremors, the dog seeming really disoriented, weak, maybe unable to even stand up. That's called a recumbency. In the really bad cases, they can become unresponsive, blind, their heart rate can slow right down, that's bradycardia, and their breathing can become slow and shallow, hypoventilation.
And that can lead to?
Tragically, yes. Coma and potentially death if it's severe and not treated.
That is a really scary list.
Yeah.
So if an owner sees signs like these and thinks, oh no, maybe it was that dewormer, how does a vet figure out if it is ivermectin?
Well, a lot hinges on the history. Was there a chance for exposure to a high dose? Did they get into horse paste? Or was there a calculation error? That kind of thing.
So history plus the symptoms.
Exactly. History and the clinical signs are key. Our sources emphasize there isn't like one specific blood test that screams ivermectin toxicosis.
No definitive test.
Nope. It's more about piecing it together and, crucially, ruling other things out.
Like, what else could cause similar signs?
That's the differential diagnosis part. Vets need to consider other poisonings, maybe other insecticides, like pyrethrins or organophosphates, or even other conditions entirely that affect the nervous system. Routine blood work, CBC, chemistry panels, urinalysis, they're usually not that helpful for confirming ivermectin specifically. Oh. But an arterial blood gas test might show high CO2 and low oxygen if the breathing is really depressed. That can support the picture.
Okay.
There's also this diagnostic trick using a drug called physostigmine. If the dog temporarily gets more alert after getting it, it might suggest ivermectin. But it's not a treatment, it's not routine, and there are risks. Sometimes they give glycopyrrolate first.
Sounds complicated. So mostly history and signs. If it is diagnosed, what's the treatment plan?
The absolute main thing is supportive care. Like we said, no magic antidote. So you focus on managing symptoms and stopping complications.
Okay.
Well, if the dog's awake, and it happened recently, repeated doses of activated charcoal can help bind up any drug still in the gut.
Makes sense, like pumping the stomach, but with charcoal.
Kind of, yeah. Absorbs it. Then IV fluids are critical. Keep them hydrated, keep electrolytes balanced, and nutritional support is super important, especially because these dogs might be out of it for a while. You want to get that started early, maybe within 2-3 days.
And what if they're really weak, can't stand up?
That needs intensive nursing. Turning them regularly to prevent bed sores, soft bedding, maybe some gentle physical therapy to keep muscles working, just really attentive care, and lubricant for their eyes, because they might not blink properly.
Eye drops, okay.
And if breathing gets really bad, mechanical ventilation, a breathing machine, might be the only option to keep them going.
Wow.
Oh, and the sources also mention using intravenous lipid emulsions, ILE. Basically, fats given IV.
Fats. How does that help?
The idea is the lipids act like a sink, pulling the ivermectin out of the tissues. It's shown some success, kind of like an antidote in some ways, but it might not work as well in dogs with that homozygous ABCB1 mutation, the ones most sensitive.
Interesting. So lipids as a potential treatment. Any other specific drugs used?
Well, again, no reversal agent. But if the heart rate gets dangerously low, that bradycardia, they can use atropine or glycopyrrolate to speed it back up.
Gotcha.
And with those lipid emulsions, the ILE, there's a specific way to give it. Usually an initial fast dose, a bolus, then a slower continuous drip. They monitor the dog's blood serum, see if it looks fatty.
Okay.
And they might repeat the dose, but usually stop if there's no improvement after a couple of tries.
Right. Now, you mentioned the ABCB1 gene makes dogs sensitive to ivermectin. Does it affect how they handle other drugs too?
Yes. That's a really, really important takeaway. Our sources listed several other drugs known to cause problems in dogs with this mutation.
Such as?
Things like loperamide, that's Imodium, the antidiarrheal, very dangerous for these dogs. Also, some chemo drugs, doxorubicin, vincristine, vinblastine,
Wow.
and even some common vet meds like isopromazine, a sedative, or butorphanol, a pain reliever. Also, certain antibiotics like imodepside and erythromycin.
So it's not just ivermectin?
Definitely not. And they also warn against using ivermectin at the same time as ketoconazole, an antifungal. And combining high-dose ivermectin with spinosad, another parasite drug, might also cause issues.
It really highlights how important it is for the vet to know everything a dog is taking, doesn't it?
Absolutely. Full disclosure is key. Supplements, other meds, everything.
So pulling it all together, what's the general outlook? If a dog gets ivermectin toxicosis, what are its chances?
It really varies. Depends on, the individual dog's sensitivity, their breed, their genetic status, how much drug they got, how fast the signs came on.
And how quickly they got treatment.
Yes, and how well they respond to that supportive care and just their overall health beforehand.
Hmm.
Recovery can take a long time, sometimes potentially several weeks of nursing care.
Weeks, okay.
But, and this is the hopeful part, the sources stress that with really good, dedicated supportive care, even dogs that seem incredibly sick initially can often make a complete recovery.
That is good to hear. A lot of supportive care, but recovery is possible. Okay, so for everyone listening, I think the big takeaway from this deep dive is pretty clear. Ivermectin is useful, but high doses carry real risks, especially for those specific breeds with the ABCB1 gene issue. Knowing the risks, the breeds, the signs, it's just vital.
Couldn't agree more. And, thinking bigger picture for a second, this whole thing with the ABCB1 mutation and how it affects drug responses, it's fascinating, isn't it?
It is.
It sort of makes you wonder about the future of veterinary medicine. Could genetic screening become more routine someday to help vets tailor drug choices, dosages, make things safer for each individual pet?
Personalized medicine for pets.
Something like that. It's definitely something interesting to think about, the implications down the road.
A very thought-provoking point to end on. Thanks for joining us for this deep dive.
My pleasure.
Until our next exploration.